In the previous video, we have discussed the intestinal polyps. In this video, we will discuss carcinoma colon or adenocarcinoma colon or carcinoma adenocarcinoma sequence, one of the large intestinal tumor, which is very important in MBBS point of view and in the clinical practice also. Let's start the video.
Colon cancer or adenocarcinoma colon. It is seen in elderly people and presentation will be with the complaints of iron deficiency anemia, and the most common site of colon cancers will be rectum, and the subtype is, as I said earlier, adenocarcinoma. The factors can be of various types. The genetic factors include HNPCC or Lynch syndrome, where HNPCC stands for hereditary non-polyposis colorectal carcinoma syndrome, which is a autosomal dominant condition. There will be DNA repair gene defects, and there will be microsatellite instability causing the risk of colon cancers and other cancers. Coming to the familial adenomatous polyposis, it is, as I said earlier, it is the APC gene mutation resulting in increased adenomatous polyps, thereby causing colon cancers. These colon cancers can be variants: Gardner syndrome, Turcot syndrome. Cancer presentation will be much earlier age. Coming to the non-genetic factors, there will be high chances of adenocarcinoma with increased consumption of dietary lipids and exposure to the radiation in the pelvic region, and frequency of ureterosigmoidoscopy, and there is a infection with streptococcus bovis, which is acting as a non-genetic factor for adenocarcinoma colon. Now we will discuss the protective factors. Eating fiber food, dietary fiber consumption will be acting as a protective factor. Clinical features will be involvement of either ascending or descending colon, but the most common site is rectum. Proximal colon cancers causes increased ulcerative lesions, thereby causing chronic blood loss and thereby unexplained anemia. Coming to the descending colonic cancers, they project into the bowel lumen, causing the narrowing of the lumen, and there will be changes in bowel habit. So, in the history, if they have given the changes in bowel habit, it is descending colonic cancer, or if there is history of unexplained anemia, fatigue, iron deficiency anemia symptoms, then it is proximal colonic cancer. And there will be circumferential growth of cancer, then it will lead to irregularity of the cancer, giving the napkin ring appearance. Napkin ring appearance is characteristic of adenocarcinoma colon. So, normal mucosa, when the mucosa is at risk because of the genetic and non-genetic factors, will convert into, with the help of APC gene mutations, first hit and second hit, causing the formation of early adenoma, KRAS mutations. Then from early adenoma, it will go into late adenoma conditions with the loss of heterozygosity at 18q21, that is SMAD2 and 4 are involved. Then this late adenoma will convert into carcinoma, which is further progresses, and there will be metastasis. So in the picture we have shown, this is a gross picture of a colon with fungating growth, that is carcinoma colon, and the pathogenesis is carcinoma adenocarcinoma sequence and microsatellite instability. In a normal mucosa, see, this is a normal mucosa with APC-B or beta-catenin mutations and primary and secondary hit. It will convert into early adenoma, and this early adenoma because of the KRAS mutations, there will be stoppage of apoptosis. They will act as anti-apoptotics and promote the growth of further cells. As a result, there will be further conversion into early adenoma to late adenoma. There because of SMAD2 and 4 mutations, homozygous loss of additional cancer suppressor genes and overexpression of COX2, it will lead to carcinoma formation with TP53, that is our guardian genome or policeman of the cell cycle is undergoing mutations and resulting in carcinoma, and further it is metastasized to either lungs or liver. So the genes that are involved in carcinoma adenocarcinoma sequence are: first one is APC, second is KRAS, third one is SMAD2 and 4, fourth one is TP53. You have to remember all these things and you have to write this sequence: carcinoma adenocarcinoma sequence, Knudsen two-hit hypothesis, microsatellite instability related to the adenocarcinoma colon. So how you diagnose this adenocarcinoma colon? So the investigation of choice will be: you have to do colonoscopy and you have to take a biopsy. Occult blood in stool will detect the further involvement or whether blood is passing or not. Okay, microscopic examination of the stool and GWAG test can be done. The tumor markers that are present here in colon cancer is: there will be increased carcinoembryonic antigens useful to detect the recurrence. And on radiology, there is a apple core appearance. Remember, apple core appearance on barium enema is a characteristic radiological finding in a adenocarcinoma colon. And the metastasis is more common to liver, followed by ovaries in females. Ovaries in females, when this carcinoma is spread, then it is called as Krukenberg tumor and it will give signet ring appearance.
Like, share, subscribe Dr. Ravichandra official for more interesting videos on pathology.